Բարև ձեզ, այսօր իմ հյուրն է հանրային առողջության փորձագետ, Կոլումբիայի համալսարանի պրոֆեսոր, առողջապահության նախարարի խորհրդական, ապրի Armeniայի փորձագետ, Dr. Kim Hekimian. Thanks for joining us, Dr. Hekimian.
Շնորհակալություն.
Dr. Hekimian, your studies in the field of public health sector are primarily focused on preventing diseases. I was wondering, how do you work with people to make them realize, understand the crucial role of health and early prevention of diseases?
Thank you for the question. When we study public health, we look for the most cost-effective ways that we can prevent disease so that people don't get sick, or that we find that disease early so that they have a better chance of treatment and having a longer life and a longer quality of life. In public health, we know that health behavior accounts for quite a bit of the disease that we have. Genetics are important, some clinical care is important, but mostly we are functions of the behaviors that we do. So that includes what we eat, what we drink, the air that we breathe, smoking, physical exercise, And so we want to think about how can we help the population be healthier by acting healthier. And we know that knowledge itself is important, but not enough. So we try to create a society that promotes healthy behaviors, because we are all a function of our own habits. It's very hard to change habits. We're growing up in a family. The family has a certain set of behaviors or a culture or a custom or a society. And so it's hard to change individual behaviors, and we wonder, can we create policies that change the environment, that make it easier to be healthy?
At what stage is Armenia in terms of public health provision?
So in Armenia, like in much of the world, the majority of our premature death. So in Armenia, about 1 in 5 people will die prematurely, before their expected life expectancy. And the main reasons for that are smoking, nutrition, and physical exercise, or sedentary behavior. So we think about ways that we can tackle those things, not just for people who are doing those unhealthy behaviors, but for the youth to not start those unhealthy behaviors. It's very hard to quit smoking because the tobacco industry creates a product to make you addicted to nicotine. And nicotine is very addictive, more addictive than most drugs. And so it's hard to quit, but it is worth preventing the start of smoking. In Armenia, we still have a very high rate of smoking, and we're very concerned about the youth who are vaping now. So the vape has become this almost ubiquitous, very high percentage of youth are using the vape. But the vape also is a nicotine delivery device, and it's sort of a gateway to smoking. And it's produced by the tobacco companies, so they know what they're doing. They're trying to get a lifelong customer early on. So where is Armenia? We still have a very, very high rate of smoking. We also have a high rate of high blood pressure, and the high blood pressure is also a #1 cause of death in this country. And we could be doing a lot better job in preventing both of those. As you know better, a smoking ban went into effect, and there's no public smoking according to the law in the restaurants.
Yes, hospitals. We know that the Ministry of Health has implemented some stricter policies on tobacco use. How do you see, was that effective?
So the American University of Armenia, where I also teach and where I started my career here, they have done some excellent studies which show that indoors, inside the cafes and restaurants, there has been a lot of success in preventing smoking. The air is much cleaner. They can actually measure that. Outdoors, not as well, so we do need more enforcement for that. They also have very good data to show that the youth are using these vapes a lot, and the vaping itself has become a problem. In addition to which, very unfortunately, illegal drug use is also very much on the rise in our younger teenage population. And that's something we really have to make an effort to try to stop.
Before this interview, I was also checking some statistics on mortality in Armenia, and it turns out that the leading causes of death in Armenia include cardiovascular diseases, cancer, and respiratory diseases. Do you see some connection with tobacco use and these statistics?
So tobacco use and nutrition, what we eat, those are the two leading determinants of disease and death in Armenia, as in the United States and many, many other countries in the world. So there is a very strong association between smoking, nutrition, physical activity, and what we call premature death. All of us are going to die at some point, but we want to die of old age. We want to have had a quality of life. But dying prematurely from heart attack or stroke, and unfortunately not only dying, but maybe living after those, but with a disability, those are big burdens to our society, to our families, to our children. So if we can prioritize putting money into and making policies to prevent those bad behaviors and to promote healthier behaviors, we will see a change in the outcomes of premature death.
You are the advisor to the Minister of Health, and it's interesting. Do you have some chance to work on such policies that you have mentioned? And how do you apply also your expertise that you have acquired in Colombia?
Great question, thank you. So through the organizations of APRI, the Applied Policy Research Institute of Armenia, and also HENAR, the Health Network for Armenia, they have created an opportunity for me, basically giving me a grant to Columbia University, to my department there, so that I can spend some of my time here in Armenia and be a policy advisor at the Ministry of Health. What do I do there? My background is actually mostly in maternal and child health, and so I'm very interested in the period that I call the first 1,000 days. That's from when a woman becomes pregnant until the baby is 2 years old. And about 80% of our brain develops in that 1,000 days. So we really want to make sure that pregnant women and newborn infants and young children have the best optimal, ideal nutrition that they can have so they can reach their top potential. So at the ministry, I am working on looking at issues of pregnancy, nutrition during pregnancy, breastfeeding promotion, but also making sure that the postpartum hospital care practices help a woman breastfeed instead of prevent her from breastfeeding. And then when it comes to the chronic diseases that we just talked about, there is a really nice lifestyle behavior campaign that the Ministry of Health has been doing now for over a year. So in each Mars, they go to a different Mars, and they have school children create posters about topics like tobacco, alcohol, healthy plate, like hagagan apse, physical activity. And then they have like a campaign where everybody is physically active, eating healthy, and some kind of like a fun event for the kids. So I see these kinds of things. I can help them, I can give them advice. We've talked a lot about the Armenian plate, creating a national Armenian dietary guidelines, because our national foods, for the most part, are very healthy. It's that we're eating a lot of junk food now. We're eating a lot of fast food now. And companies like, Coca-Cola or other globalized companies are selling foods that have no nutrition in them. And that's a problem.
How do you think that people in Armenia generally approach to health, physical activity, and, as you mentioned, nutrition? Do you think that it's well prioritized in Armenia? Because we know that, I don't know, maybe it comes traditionally or from our mindset, but sometimes we see that people don't prefer to go to doctor if they have some disease or some other health issues. How do you think?
Armenia has undergone so many crises in the last few years, and many people are grieving. These crises sometimes make it feel like, why should we prioritize? If life is so difficult, why not let me have the pleasure of a cigarette or of eating unhealthy food? But here's the truth. We all want to have the strongest society that we can have, and health and being healthy is part of our national security plan as well. So we want to find ways we can make it easy for people to be healthier. So right now, as an example, if I sit inside a cafe and have a cup of coffee, I will not be breathing in bad smoke. That's because of a policy that was made. Maybe we can also, for example, take some of the salt out of some of the foods, just a little bit, not to change the taste so much, but to reduce the risk for high blood pressure and having stroke and heart attack. You mentioned going to the doctor for prevention. You're absolutely right. That is not our tradition here in Armenia. And so one thing we do have to think about is, how can we motivate people to get screened early on for these diseases? And also something that I am struggling with, once we screen people for, let's say, high blood pressure, we have data that shows that of people who are diagnosed with high blood pressure, less than 1/3 of them actually take their medication every day. These are things that are cultural, they're customs, they're long-standing habits. So we have to do the research and use research to learn what is the best way to help people do healthier behaviors.
And could you find some ways or reasons for yourself to find some ways to maybe work this problem out and maybe change the mindset or human behavior?
I think that, again, there's health behavior change is complex. We are all a function of our psychological backgrounds, our environment, our social backgrounds. So changing behavior for you or for me might be a little bit different than for other people, right? What we've learned over the years is if we can change the environment just a little bit, maybe with some education as well, then we might be able to see behavior change. So, for example, in my area of interest, which is in this idea of what happens to the baby right after birth, right? As I was looking to reactivate those conversations, I learned here, for example, that the rate of cesarean delivery has just skyrocketed. It's over 40% now. That means for every 10 babies that are born, 40 of them are born by cesarean. They're separated from their moms at birth. They're not put right onto the breast to breastfeed. And there are a lot of other issues that happen that make it harder to give the ideal food to the infant, right? And so I started to think, what could we do to reduce cesarean section? And one of the things we need to do is to revise our clinical guidelines about when it's acceptable. For example, in this country, there's a belief that if you wear eyeglasses, if you have myopia, that you have to have a C-section. That's not really true. That's not evidence-based. So how can we bring in sort of a new overall set of multifaceted, right? So it's education of the mom, education of the healthcare personnel, changing clinical guidelines, but also understanding our culture. I have heard, and this is new to me, I have heard a lot of women say they don't want to breastfeed because they're very worried about how it will affect their figure. But maybe they don't know that it will not harm their figure to breastfeed. Maybe these are things that we can do some education on. So we'll see.
Dr. Hekimian, you have mentioned some challenges in the Armenian health sector as well. And we know that the health sector in Armenia has undergone significant challenges and transformations due to the events of COVID-19 pandemic, 44-day war in Nagorno-Karabakh, followed by some other subsequent challenges. Where do we currently stand, and how do you think, what are the best practiced policies to mitigate the negative impacts of these events?
Again, another great question. Thank you. Armenia, as I've mentioned earlier, is under a lot of different stressors. One of the things that's important, I think, for the audience to know is that our public government expenditures on health are, by percentage of our economy, percentage of our gross domestic product, is relatively low. About 1.4% of our health system is funded publicly. Armenia has the highest rate of out-of-pocket payments of any country in the world where it's been measured. So we spend a lot from our pockets for our healthcare system. And sometimes that's really to our detriment. Even though we spend a lot of money per person, we don't have a higher life expectancy. So what does that mean? That means we have issues with quality, issues with prevention, issues with early diagnosis and treatment. All of these are things that we should be working on. So since I've been an advisor at the ministry, which is only a couple of years now, the priorities really have been thinking about how to expand access to everyone with universal health care coverage, but really how to focus in on the primary healthcare system, how to have people trust their physician to go early for the diagnosis, as you said, and then to take their medications as they're supposed to. And really this whole conversation about quality, very, very important. What do we mean when we talk about quality? In the former Soviet space, right, so in the Soviet Union, the measures of success for a health system was how many doctors per population, how many nurses, how many hospitals per population, how many hospital beds. But none of those metrics mean that the health outcomes from those doctors, nurses, hospitals, that the health outcomes are improving. Those were not the metrics of success. So the challenge for Armenia is to transform from a system where the goal of that system was to have as many people as possible working in the system and as many hospital beds as possible, to now we want to be much leaner and think about our limited resources and how we get the most health for those resources. That's a challenge.
When it comes to the diaspora, I would like to mention this fact because we know that between Armenia and the diaspora we have cooperation, and we see that many diaspora doctors contribute and apply their expertise in the health sector in Armenia. And but how do you evaluate this cooperation between Armenia and the diaspora?
That's a great question. And I think it's an important question, especially being from the diaspora and having diaspora advisors in this sector now. So I think that the model is beginning to change, and it needs to change. So originally, when Armenia became independent, first of all, let's start with the earthquake and then Armenia's independence, there was a need for a lot of humanitarian assistance. But unfortunately, that humanitarian assistance didn't change the system. And in fact, it might have harmed some aspects of the system. Now we're at a stage where we have to think about how can the diaspora help us in what is the priority for Armenia for strengthening their healthcare system. And one of the areas we're thinking that we should continually be pushing on is in the field of medical education and in training and in research. So we think that we can focus the diaspora on some of these areas to, again, build capacity in Armenia and work as a partner with Armenia to meet their needs, quality, strengthening of primary health care, and expanding access.
Thank you so much for the interview.
You're welcome.
Հարգելի հեռուստադիտողներ, հիշեցնեմ, որ իմ զրուցակիցն էր հանրային առողջության փորձագետ, Կոլումբիայի համալսարանի պրոֆեսոր, առողջապահության նախարարի խորհրդական, ապրի Արմենիայի փորձագետ դոկտոր Քիմ Հեկիմյանը։ Կհանդիպենք։